Hello everyone, I am Rohit Vats and you are watching Health Plus. Today we are with Dr Gagan Saini and we are going to talk about the big C. Welcome to the show, doctor.
Thank you, Rohit.
Why do you think there are so many new patients of cancer increasing every year? What could be the reason behind it?
It's very interesting, no, that each and every one of us nowadays hears about a cancer case amongst our near and dear ones. It's almost like it's present in each family. And I guess that's where your question is stemming from, that why is the cancer increasing so much? Maybe if you look at it, it's a perception of the cancer which is increasing a lot. And that is because of a couple of reasons. Reason number one is, first, we are a large population. And then we are an urban population now. And the urban population definitely has more medical resources for diagnosis now. So that large urban population, even if the percentage of patients who are going to get cancer at the end of the day is fixed, the absolute numbers is large. Then the people are living for a longer duration. That's a good thing. But then the problems with living for longer duration does kick in. It's not going to kick in for everyone, but a certain percentage is going to get it. So at the end of the day, a large population, an aging population, and a population which has means towards medical diagnosis, and also great doctors. Doctors are great now. Specialists, super specialists are everywhere.
Much better doctors than before.
Much better doctors than before. They can diagnose cancer. Earlier it used to be diagnosed at advanced stages and maybe not even diagnosed at all. Maybe a person would not even reach the doctor. So that is the reason why the perception of an increased cancer incidence is there. Some cancers perhaps have increased, but overall the cancer incidence is more or less stable. But the absolute numbers have increased a lot.
I also want to add one thing here, that we rarely see survivors. Of course there are, but the number is very less. So what is the reason that we are not getting any victory, sizable victory over cancer?
I will give a very unconventional answer for it. We are getting a lot of victories on cancer. In my OPD, I'm doing follow-up of so many patients. I'm not going to be able to give you data right away, but the victories are left, right, and center. Victories are there. There's something very interesting about this phenomenon which you said. That phenomenon is there, by the way. But that phenomenon again is of perception, if I may say that. A person who is going to die of cancer in a society. When I say society, I mean the society we say in our urban areas, building, couple of buildings. That thing cannot be hidden when a person is going to die. So we always hear the negative parts of cancer, the negative connotations of cancer much more than the positive connotations. A person who has survived cancer will probably not even tell his near and dear ones. So you will not get the success stories. Now, I personally have a patient and his father, both of them have cancers, both of them have survived. But both of them have told me not to tell each other. Although the fathers think the son knows now. What I'm trying to say here is that if this is happening so much in families, imagine how it is within your friends and peer groups. I have a patient who fought off cancer before marriage and now his present wife doesn't know. So let alone the society will know that success story. So I'm going
People are not very open.
Yes, please.
About sharing their experience of victory over cancer.
Yes, please. So it still is like a taboo that you had cancer. You would be some sort of a second-grade citizenship a person may end up getting. That's the thought. So that is the reason why we only hear the negative side, which really cannot be hidden. The negative stories.
I was reading somewhere that there are pockets in India that see more cancer patients than other areas. Like Kerala is there, Punjab, Mizoram, Assam. But what is the reason why it is happening? Why so many cases of cancer in those areas?
So the Northeast is especially unique to this because Northeast has so much tobacco use that it's unbelievable. Northeast, as I'm not a culture specialist, so my comment should not be taken about a comment on a culture as such, but it's a medical comment. So that is the part of the country where tobacco is ingrained into the day-to-day lifestyle. Tobacco is not an ill. Like for example, in different other societies, tobacco is like an ill. Somebody would like to hide it from your family if you are smoking. People still do that. In Northeast, you are gifting tobacco as a part of in weddings, and smoking is a thing. So smoking is abound. That is why Northeast is a very special case, especially Mizoram, because the cancer is really abound over there for the specific reason of
what about
tobacco.
Punjab?
Punjab, I think the explanation lies in the increased amount of pollutants which has accumulated thanks to the non-biodegradable complex substances like fertilizers and other things, which ultimately go into a person's body and has a potential of causing a higher rate of inflammation, which can lead to cancers. Of course, this is not fully substantiated. Some parts are not very well substantiated, but yes, this is one explanation.
So, can we say that that we are also responsible for bringing cancer to us because of extra use of say pesticides, or by bringing tobacco into our daily lives? So, if I ask you to pinpoint the reasons behind it, what could be there?
It's very interesting to realize that tobacco as a carcinogen, as a possible cause of cancer, we talk about it with such elan, and this is not a result of a day's work. It's a result of decades of work which was done by many people to create this awareness. So yes, tobacco is definitely one very big carcinogen, but you told me to list them. The next one is sedentary lifestyle. Sedentary lifestyle is an equally big carcinogen as tobacco.
So sedentary lifestyle,
yes,
can, apart from giving you blood pressure and diabetes, they
yes,
can also give you cancer.
It can give you cancer. There is research which backs it. In fact, if you draw a graph where you see the number of cancer cases being caused by tobacco, number of cancer cases being caused by sedentary lifestyle will be equal. So sedentary lifestyle is the new tobacco, and that is something we need to fight. And what is sedentary lifestyle? Sedentary lifestyle is something where there is a lack of definitive movement or exercise every day. There are definitions for it. It is something that can be associated with being a couch potato, watching TV, eating your food while sitting down, and that sort of a thing. Sedentary lifestyle does not mean that, okay, fine, I'm not exercising, so I'm having a sedentary lifestyle. Like for example, maybe if you and me don't exercise, that may not count as a sedentary lifestyle. So sedentary lifestyle is a little bit nuanced, but yes, sedentary lifestyle causes cancers which are different from the tobacco related cancers. That thing causes mouth, throat, lungs, aerodigestive tract, and so on and so forth. Whereas the sedentary lifestyle, it causes different sort of cancer, gynecological malignancies, stomach, colorectal cancers, so on and so forth. So this is very unique.
That also brings me to the point where I wanted to ask that sometimes even if cancer is diagnosed, we will come to the fear of cancer later, but the diagnosis also happens quite late. Despite medical advancements, can we fasten this process, or is there any likelihood of this fastening in future?
I agree with you. So the problem with cancer is that it is rare. We have to understand that no matter how much we are scared about it, no matter how much we feel that everybody is getting it, at the end of the day, it is still very rare as far as a population is concerned. So a population cannot be screened for each and every cancer all the time. That does not lead to what is called as a cost benefit. There is a cost to everything and there is no benefit to it. So what has been found is that cancer, to be diagnosed early, you need to screen. So you can only screen for those cancers which are going to be more common in the population, one, and also an early diagnosis should lead to a survival benefit. I'll give you a negative example here. For example, a brain tumor, खास करके a high grade brain tumor, no matter how early you diagnose it, the survival remains the same. I'm just giving you a negative example here. And on the other hand, there is breast cancer, where if you are diagnosing
early diagnosis can lead to a better life.
Amazing life. You can lead to 70-80% cure rate in early breast cancer. That's cure rate, 70-80% cure rate. So that level. So that is why breast cancer awareness and breast cancer mammography, breast self-examination, those things are so well emphasized in the medical fraternity and by the medical fraternity. So the rest, there are so many cancers, but unfortunately, even if you screen for them, you don't know when you're going to get it, and when a person is getting it, you may not be screening for them. That is why it is not possible to screen for all the cancers. However, currently, the recommendation for screening is for breast cancer, cervical cancer. Cervical cancer is bachchedani ka cancer. Cervical cancer, sometimes cervical is considered neck, but cervical is the bachchedani ka cancer. And the next one being colorectal cancer, especially in the Punjab belt and all. And then nowadays, for patients who are having 20-pack-year history of cigarettes and tobacco usage, smoking tobacco usage, they should undergo what is called as lung screening. So there is a proper
so
protocol
that they could understand.
Yes, so that early lung cancer can be diagnosed. Now, what is 20 pack years? So if you smoke 1 pack for 20 years, it becomes 20 pack. Suppose you smoke 2 packs a day, and for 10 years, so it becomes 20 pack years. So that is a pack year mathematics for the common man. Having said that, for males, again, it is this colorectal cancer and this thing. Now, we all know that mouth cancers, throat cancers, and these cancers are so common amongst males, and mostly males are getting it. And India is having 50% of the world's mouth cancer cases. Yeah, 50%.
That's huge number.
That's huge number. But even then, we don't have a strict screening policy for these patients, because screening, unfortunately, does not yield to better outcomes. So we encourage the patients whenever we go for talks that if there is any ulcer or something, or if there is a bleeding which you can't understand, then you please go to the doctor and get it done. Now, this answers part of your question, that why can't we hasten the diagnosis for cancer. The first hastening of diagnosis of cancer is improvement of screening, so that you can really catch it early. The other is a frustration which I can feel, because we see it in our patients that why did I have to say be with the doctors for some people for a couple of weeks, but some people even a couple of months before the cancer was actually put on the paper and the treatment was started. That is because
the process of understanding it fully takes a lot of time.
Yes, sometimes the symptoms are so vague. The symptoms are so vague that doctors...
they can be symptoms of various other diseases.
Thus, now to break it, there are of course newer things which are coming in. There are genetic signatures which are coming in. Of course, they are not fully there yet. I must add that maybe over a course of time there will be genetic signatures which will already tell you that what sort of cancers you may be having a propensity for, so that you can screen for only those cancers more commonly in you and me. Like I get my thing done and I get screened myself for those cancers a little more often. I guess that would be a very big breakthrough for this thing, and will break this problem of screening everybody and also not screening everybody. So there will be a midway between that. So I hope that medical advances catch up to our expectations. I really hope so.
I also hope so. डॉक्टर, कैंसर से भी बड़ा होता है कैंसर का डर. एक बार हो गया तो पूरी फैमिली इन्वॉल्व होती है और काफ़ी पैसे लगते हैं, क्योंकि कॉस्टली है, इलाज बहुत महंगा है. कैंसर के डर से कैसे विजय प्राप्त कर सकते हैं?
किसी ने भी नहीं किसी को कैंसर को बुलाया, कोई नहीं चाहता उसे कैंसर हो, बट अगर उन्हें कैंसर का डायग्नोसिस लग रहा है तो जितनी जल्दी फाइट स्टार्ट करें. ये स्पेशली रेलेवेंट है लेडीज़ के लिए जिनकी ब्रेस्ट में लंप होता है और वो नहीं बताती हैं, और उसके बाद फिर वो बीमारी मेटास्टेसाइज हो जाती है. फिर भी तो फाइट करना है, तो पहले क्यों नहीं फाइट कर लेते? सो पहली बात तो ये कि कैंसर का डर नहीं रखना चाहिए.
अवेयरनेस भी उस लेवल का नहीं,
अवेयरनेस उस लेवल का नहीं है. एक ये कॉस्ट का जो एक कॉन्सेप्ट बन गया है कि कॉस्ट बहुत ज़्यादा है. मैं ये नहीं कह रहा कॉस्ट बहुत कम है, मैं ये नहीं कहने की कोशिश कर रहा हूँ. कॉस्ट एक रिलेटिव सब्सटेंस होता है, एक रिलेटिव बात होती है. किसी के लिए एक सर्टेन 100 रुपीज़ ज़्यादा है, किसी के लिए 100 रुपीज़ कम है. हम कॉस्ट को एज अ नंबर डिस्कस नहीं करें, पर कॉस्ट को एज अ परसेप्शन अगर डिस्कस करें, तो अब गवर्नमेंट की हेल्प से छोटे सेंटर्स भी एम्पावर्ड है. बड़े सेंटर्स तो थे ही हमेशा से, और छोटे सेंटर्स भी एम्पावर्ड है. सेंटर्स में डॉक्टर्स भी हैं. चीज़ें मूव कर रही हैं ग्राउंड पे. टियर 2 के अंदर, टियर 2 सिटीज़ के अंदर कैंसर की ट्रीटमेंट की सुविधाएं उपलब्ध हैं. And
at least the fight should start.
At least the fight should start, Chief. At least the fight should start.
As an individual, what one should do to avoid, being affected by cancer?
Prevention is, of course, by not smoking, by keeping an active lifestyle. There is a specific definition to an active lifestyle, wherein there should be at least 60 to 90 minutes of movement per day. That is active lifestyle. 60-90 minutes अगर नहीं है movement per day, तो वो active lifestyle में नहीं आता. That should be our aim, and this is what we can do to prevent it. Of course, the other thing that we can do to diagnose it early is by going through screening processes. Screening processes जो है वो आपके या तो कैंसर स्पेशलिस्ट आपको बता सकते हैं, या जनरल फिजिशियंस या जनरल मेडिसिन जो आपकी फैमिली डॉक्टर्स हैं वो आपको उसके बारे में बता सकते हैं. सो दैट इज़ द अदर पार्ट ऑफ द स्टोरी. नाउ वी कम टू रेमेडी पार्ट. रेमेडी माने अब थेरेपी. अब हो गया है तो क्या उसमें थेरेपी की जाए. आमतौर पे कैंसर्स में क्यूरेटिव थेरेपीज़ दो तरह की होती हैं. एक होती है सर्जरी, एक होती है रेडिएशन थेरेपी. ये लोकल थेरेपीज़ होती हैं. जब कैंसर फैला नहीं है तो आप इन दोनों मोडालिटीज़ से डिपेंडिंग अपॉन द डिजीज़ की नेचर, डिजीज़ की बायोलॉजी, आप दोनों को फोकस करते हैं। द थर्ड मोडालिटी इज़ कीमोथेरेपी। Chemotherapy is basically therapies which target the fast dividing cells in general. उसके कुछ side effects वगैरह होते हैं,
some aggressive cancers,
aggressive cancers के लिए होते हैं, but the point is now chemotherapies have evolved into targeted therapies. अब हम पेशेंट्स के कैंसर के टारगेट, जो उसके अंदर मॉलिक्यूलर सिग्नेचर में जो टारगेट है, उस टारगेट के हिसाब से आप उसे फोकस कर सकते हैं। इससे फॉर ऑल प्रैक्टिकल पर्पसेस कैंसर के सेल्स को ही सबसे ज़्यादा नुकसान होता है। नॉर्मल सेल्स को फिर भी थोड़ा बहुत नुकसान होता है, ऐसा नहीं है नहीं होता, बट फॉर ऑल प्रैक्टिकल पर्पसेस इट इज़ नॉट एज बैड एज अदर थिंग्स कैन बी। तो दिस इज़ द 3-step approach I have elucidated.
You see a very hopeful future for those impacted by cancer.
Oh yes, I see a hopeful future for those impacted by cancers, because I see that those impacted by cancers will be diagnosed early by screening. I see those impacted by cancers being treated better due to better availability of doctors and equipments, and also their positive approach, because there is success in this treatment, and that positive
the entire
approach,
family and their society will have to come together to fight it.
I totally agree with you. Social capital इसमें जितना important है इस बीमारी में, उतना और शायद किसी बीमारी में important नहीं है.
So there is no reason of losing hope.
Definitely not.
So on that note, thank you for your time, doctor. We will soon come up with another episode with another expert. Till then, thank you.